Good evening, friends, and welcome to this special meeting of the Lozells Ward Forum. It's a Lozells Covid briefing that I'm hosting, Councillor Waseem Zaffar. I've been joined by a local general practitioner, a local GP, Dr. Munir Aslam, who's also the chair of the West Birmingham Place-Based Commissioning. So somebody who's really, really important in our neighbourhood, somebody who really knows the answers to all the questions relating to COVID. We should also be having somebody joining us very shortly from Birmingham City Council's public health team. I know they're extremely busy and there's a series of meetings taking place this evening. But look, we've still got challenges with respect to COVID. We've had challenges for the best part of 16, 17 months now. We can't rest on our laurels. There's still a lot more work that needs to take place in our communities. We know that the vast majority of people are following all the COVID guidelines, doing all the right things, but we just need to do a little bit more, and particularly we need to do more when it comes to getting vaccinated and also getting tested. So I've got all sorts of questions that I want to ask Dr. Munir Aslam. Sorry, we've also now been joined by Dr. Mary from the public health team at Birmingham City Council, who works very closely with Dr. Justin Varney. Good evening to both of you.
Good evening.
Good evening.
Thank you for joining us. And if you're watching this, whatever platform you're watching this on, please post any comments, any questions. They will come up on our system, or we can bring them onto our screen and hopefully get the experts to answer the question. Dr. Munir, so what's the situation currently with COVID?
Okay, so we're aware that our rates in Birmingham in particular are increasing. The latest rates published on the local authority website are around about 125 per 100,000. The predominant strain that we're getting at the moment is the Delta strain, or the Indian variant. So that's where we are in terms of rates in our communities. We're starting to see a transition between young people having COVID and becoming unwell to slightly older people and people requiring hospital admission. So we are starting to see a slight increase in the people in intensive care. We're starting to see a slight increase in the people that are admitted to hospital with breathing problems. And we are seeing a younger cohort of people at the moment that are becoming unwell. So in the first and second waves, we saw people predominantly above 50. We are seeing a younger cohort of people now. So I think we're in a precarious position. We have options that we didn't have in the first and second waves, which is a vaccination program that will prevent people becoming unwell and is really effective. So both jabs, the AZ jab and the Pfizer jab and the Moderna jab, very effective at preventing hospital admission, very effective at reducing your risk of becoming really unwell. And I think a really important point to make here, Councillor, is young people, we've consistently given them a message to say, you won't become unwell, you might have a symptomless illness. I see a number of young people who end up with long COVID, having had a COVID viral infection, and it's debilitating. It really affects their ability to cope, to get out. They have breathing difficulties, they have a lack of energy, and it's really debilitating. So this notion that just because you didn't go to hospital, that you are safe, I think for the younger people, we really need to start, exactly, it's not true. So we need to really start reinforcing that if you get COVID, it could make you very unwell and give you a problem that doesn't require hospitalization, but lives with you for many, many months. So I would encourage all the young people to get tested if they're unwell, get vaccinated. Everybody over 18 at the moment can get vaccinated. And we've got a range of options that we'll talk about in a little while.
Dr. Mary, do you endorse everything that Dr. Munir said? Would you like to add anything else as well?
I would absolutely endorse it, and I think particularly because we're talking to communities in Lozells, where you've got the entire age range as you have elsewhere in the city, but we've also got lots of young people. And I think there has been a sense, just observing what's happened both in Birmingham and across the country and across the world, that yes, in the early stages, lots of older people were affected and people with lots of other illnesses. But that's not to say that it's a get out of jail card for young people. And as you said, we are starting to see people with what we call long COVID, and we don't know how long COVID might be. So, this is a situation that you want to avoid if at all you can. You do not want to pick up something that's going to compromise the quality of your life, possibly for months and years, if you can avoid it.
Dr. Mary, what is the situation in hospital? Has hospitalisation really come down?
Well, hospitalisation rates, as far as I understand it, are actually going up again. But what we're not seeing is, before we'd have a certain number of people going through hospital, quite a number of them requiring what we call intensive care and high dependency support, and then unfortunately a number of those dying. We're not seeing that at the moment, and part of the reason we believe that is that we're getting younger people going to hospital who are typically healthier. But as we just talked about, we don't know which of those people will recover completely and which of them might be unfortunate to get what we call long COVID. And the key is that this time a year ago, we didn't have many options. Now we've got a much better arsenal. We understand what we can do more to prevent it. We have testing that is available, in your homes. It can come to you. You can go to it. You can drive. We're in a much better position to prevent getting COVID now. And then there's a vaccine that is on offer. So, and we've rolled that out across the age groups. It's now available to young people. So anyone over 18 should be able to go and get a vaccine. If you've declined it in the past, I will say, you want to take it, you've changed your mind, just go for it. There's nothing against the fact that you might have declined it last week. You can change your mind and go for it.
Great. Those watching, if you've got any questions and you've got any comments, do post them to the two experts from public health and a general practitioner. Dr. Munir, before we start talking about the vaccination of young people, and as you said, Lozells is a relatively young neighbourhood. We still have over 800 over 50s who have yet to be vaccinated. So what is your message to those who are over 50 and yet to be vaccinated?
I think I would concur with the message that we said previously. If you've changed your mind, you wanted to wait, you wanted to see the data, you wanted to see how others reacted to the vaccine, we are here now. We're at the stage where we've got really good data, very effective at preventing you from having a serious illness with COVID. If you've changed your mind, I will help you. Speak to your GP if you're further concerned. There are people out there to support you. If you change your mind, get the vaccine. It's available to you. If we made it complicated before, we're going to simplify that. Lots of places to go to get the vaccine. Everyone in your household that's an adult can have the vaccine now. So if you want to all do it together, great. And we've got lots of different types of options for those people. If they want to walk into a place, we've got options for that. If they want to book through the national booking line, we've got options for that. And there's a variety of places, community pharmacies, sports arenas, and we've got these mobile vaccination units that are wandering around as well. So if you were waiting, you wanted more information, it's here, it's available, it's clear that this will prevent you becoming seriously unwell. So please get vaccinated. It's okay to change your mind.
So, Dr. Mary, which vaccinations are available? And the one question I always get asked is, which is better for who?
That's one that I would defer to the clinician. What I would say to people is, go to where the vaccination is being offered. I've had mine, and they put up a sign saying what is available, if it's a single one. And if it's a situation about your age or a particular condition, you can either have that conversation prior, or you get there and you have a conversation with them. There's nothing about you get there and they're just going to grab you and stick something in your arm without a discussion. So I'd say to people, have the conversation prior if you've got concerns, or just turn up. We've got facilities that are open even this weekend. Just turn up. If you've got any doubts, any concerns, have that conversation with the clinicians on the ground. They're doing this day in, day out. So I'd say take your advice from them as to what you're comfortable with, what's appropriate for you in your circumstances. But get there.
Dr. Munir, this very important question is reflected to you.
Yeah, so the JCVI have said that it's very that if you're under 40, they would prefer you to have a Pfizer vaccine. Both vaccines are excellent. Let's start with that. Both vaccines have amazing data for vaccinations, actually. So 92% effective for AZ vaccine at stopping hospitalization and serious illness. 96% for Pfizer. These are really, really good vaccines. Both of them are. Most vaccination places will only have one or the other. The Pfizer vaccine is available at the mass vaccination sites this weekend. So if you go there, you'll get vaccinated. If you want to have a further discussion, either have it at that point when you're there, or contact your GP. He'll be happy to have a further conversation with you.
So Dr. Munir, we're in Lozells. So obviously we've got viewers from right across the city and beyond, but this is a briefing ultimately for the residents of Lozells. For those people in Lozells who are currently watching who want to get vaccinated, where can they get vaccinated from?
Okay, so if you're over 18, you're entitled to get vaccinated. You've got two options. Either you call the 119, and they will give you the range of options that are around you, and be able to book you into the most appropriate place for you. So we're talking about mass vaccination centres. We've got City Hospital, which has got a vaccination hub that's running 7 days a week, and that takes walk-in people also, as well as booking online. And then we've got a range of pharmacy options as well. Think places like Tower Hill Pharmacy, places like Masters Pharmacy, places like Nishcam Pharmacy. There's a whole list. And in your chat bar here, you've got Where Can I Get Vaccinated, which is a CCG-led website, which is updated on a regular basis. It will cover all of the places that you can get vaccinated that are close to you. Range of other information on there as well about videos from a range of different health professionals and community leaders as well. So where you can go, and you can see here that there's a range of it. Will cover City Hospital Rehab Centre as well. So those are the max vaccinations. If you go further down, Aston Villa is open every day as a vaccination hub. Only has Pfizer, and there's a range of other pharmacies there as well. So you can see them on there: the Well Pharmacy and Great Bar. Phillips Pharmacy, all of those, and the postcodes are there for you to pick out where the most appropriate place for you is. It doesn't matter how far you travel, these places are all very close. The most important thing is that you go and get vaccinated.
Great, and we've heard in Dr. Mary in the last few minutes, just before we came on live, that this Saturday there'll be vaccinations available from the Holt School site. It's my former secondary school, right in the heart of Lozells. So on Saturday, you can turn up, anybody over the age of 18, from 9:30 onwards, and get vaccinated. And there'll be a team of Lozells activists who will be out on Saturday engaging with local residents and encouraging them to take up this vaccine. So there's been a lot of conversations leading up to today's meeting between a whole host of people from the community and the NHS system. And we've got a real action day on Saturday to try and get as many folk as possible in Lozells vaccinated. But don't wait until Saturday. You can go along to the Villa, Aston Villa, also known as the home of the greatest football club in the world, and get vaccinated. Where better to get vaccinated than the Holt End at Villa Park? It is absolutely amazing. And if you're not a Villa fan, just the experience of getting vaccinated there should be enough to encourage you to get down there. I've got a specific question around testing that's come in. So the testing centre at Villa Street in Lozells, I understand there's a question here from a local activist that I'll just bring here, Javid Kicker, who's asking why is the walk-in test centre on, I think it's Villa Street he's referring to, open for walk-in only from 8 a.m. till 1:30 p.m. Can anybody answer that question, or does somebody want to take this away?
We can take it away, but you can, I mean, there's a range of testing options that you can go to. Again, use the central booking system for that, but your pharmacy will be able to give you lateral flow tests on a basis of as you require them. So please don't let the facility or the ability for a place to be available to you. There are lots of places where we are doing vaccinations on a day-by-day basis.
Okay, so there's another question here from Wasif, who's asking what will happen in terms of people who refuse to have the vaccine done.
Look, I think we've been going through a tremendous a tragedy, really, for our communities, for society, worldwide. The one opportunity for us to get out of this mess is to have people vaccinated so we can move on. So I would encourage you to take a personal view where you say, I want to protect myself, protect your families, protect your communities, and protect us so that we can move on. There's lots for us to do, lots for us to achieve, lots for our children to achieve, actually. And actually, we've put that on hold to deal with this. So I would say it's the right thing to do. It's a safe vaccine. We need to move on. Please get vaccinated. We've talked about young people thinking that they are immune to this. They are not. Long COVID affects them. I've seen it in my own practice. Lots of young children or young adults becoming affected with long COVID, and that will be the basis of a chronic disease for them. So avoid that. Get vaccinated. There's lots of options for places for you to go to get vaccinated. Do it as soon as possible. It will come a time, I think, Councillor, where travel will be restricted for people that are not vaccinated. So think about that. You know, for a long time, people that have been going on pilgrimage have required vaccination. So we know that we have to do this to get to where we want to get to. So please, just I think we need to move on, and a vaccination is an opportunity for us to do that.
So, if I can also add to that, will the government? I'm asking myself this question: will the government ever make it compulsory for everyone to get vaccinated? I doubt that very much. I don't speak on behalf of the government, but I doubt that very much. But what will happen is there will be airlines, countries, and institutions independently taking decisions which will make it compulsory for you to access their services. To access their services, you have to be vaccinated. And we know the NHS app now is live, which connects your smartphone to your medical records. And what's very, very clear there is those who've had 1 vaccination or 2 vaccinations. And there could be institutions that ask for evidence of you being vaccinated. So I don't think there'll be a passport, but that ID, that particular app would go a long way. And as Dr. Munir said, we know that some countries have already taken the decision. So for Hajj and Umrah pilgrimage, there could easily be a decision. I think in the coming months you'll see airlines take that decision where they will welcome passengers on board if they are vaccinated. Don't take this as Bible. I'm not speaking on behalf of any organization, but this is clearly assumptions that I'm making from conversations that we've been having independently. Mary, did you want to add anything to this question?
So, Councillor, can I just chip in there? I mean, what we have seen, we've been offering vaccination out for about 6 months now, and what has been shown very clearly, both within Birmingham and also nationally, is that there are a significant proportion of people who were hesitant to have the vaccine initially, who have changed their minds. And so, when we say it's not too late. There are people who wanted to see what would happen. Let's find out more about it. You change your mind, you get the vaccine a bit later. But the whole program of doing vaccination is not new. We offer vaccination to people from antenatal right through newborn babies, until people who are senior citizens as well. And so people have always had a degree of choice. What we would encourage you to do is exercise that choice and have that vaccine. But a situation in which, as a society, we would be, what would we do for people? There's always been a choice. But in most circumstances, people understand this is an option, this is an opportunity, you can protect yourself. And when you're very young, that decision is made for you. When you're a bit older, you make that decision for yourself. What I'd also encourage is that those members of our community who have had the vaccine should speak up. Because sometimes people think, well, no one else is having it, I'm not going to have it. A significant proportion of people have changed their minds and decided to have the vaccine. And I'd really encourage them to speak up so that people know it's ordinary people like us who have had the vaccine.
Brilliant. So, Mary, just to confirm, I've had the Oxford vaccine. I've had both doses of it, and I'm absolutely fine. And to be honest with you, I feel comfortable going out there now that I'm fully vaccinated, and getting on with as much as my day-to-day activities, both as a councillor, but just my general social life within COVID rules too. There's another question here from Councillor Mohammed Aklak, MBE, and the question is there a shortage of the vaccine here in Birmingham?
So 2 MBEs, brilliant. There is not a shortage of the vaccine. There is enough vaccine for everybody that wants to get vaccinated to get vaccinated. If we don't use the vaccine here, it will go somewhere else and somebody else will use it. But at the moment, all the people that want to get vaccinated can have the vaccine. There is not a shortage in Birmingham at the moment.
Great, thank you. Okay, can we have some data on who's had the vaccinations in Lozells? I think Dr. Munir, you've got some data, haven't you?
So I've got some data that so 71% of adults have had the vaccination. This is across Birmingham and Solihull, and 52% have had both doses of the vaccination. Let's be clear here as well. We know with the Delta variant, your protection comes with the second vaccination. We've opened up City Hospital for a walk-in service. We had a few people come today that hadn't waited the 8 weeks until the second vaccination. I'm afraid we can't cater for that. Your second vaccination will be close to the 8 weeks, but people were turning up 2 or 3 weeks after they had the first one. So the vaccination rates are okay. They are different in different communities, and let's be clear, in the Asian and Indian communities, they are lower than we would like. In the Afro-Caribbean community, they are lower than we would like. But there are plenty of people that have had the vaccination and are doing, in the interest of declaring, I have also had my vaccination. I had it early on. The comment about, are the government going to make it compulsory? They've made it compulsory, or in the process of making compulsory for care home workers, haven't they? So, and they'll make it compulsory for NHS workers, I'm sure, going forwards as well. I don't think we necessarily have a right to say that we want to expose other people to an illness that we're carrying. And I think that's been a clear remit for NHS workers for quite some time. If you're a surgeon, you have to get vaccinated against hepatitis, and I think that is coming for us. So I think, yes, the government shouldn't intervene on person's personal liberties, but actually there are situations and jobs that you do that will carry an obligation to get vaccinated, I feel. So,
yeah. So do we have any data in terms of the percentage of number of people who've been vaccinated in Lozells, both first jab and second?
I have some.
Yep, please, Dr. Mary.
I can share some of that. So at the moment, it's a bit of a gradient, but it won't surprise anyone. Our older citizens, we're nearing the 80% mark, which is 4 out of 5, which is good going. Obviously, we'd like it to be higher than that. It is higher in other parts of the city. Unfortunately, as the age gets younger, the uptake is not as good at the moment. So that's not a finished job. There are still places you can go and get jabbed. So by the time we get down to our population of about 40 years and over, we're looking at about 60%, which is about 3/4 of what it is when people are sort of 75, 70 and 80-year-olds. So we really need to encourage our younger residents to take up that vaccine.
So, Dr. Munir, some of those younger folks didn't access the vaccine at the pop-up vaccination centres. We've had one at the Lighthouse Centre in Lozells. We've had a couple at the Finch Road Health Centre too. We've got another one on Saturday at Holt School. Any idea what the take-up was like at those particular pop-up centres?
So I don't know specifically the numbers on those days, but they have the capacity to treat around 800 people, and so we've seen that. We've seen queues of people waiting to get vaccinated. They are great, and if your lifestyle permits you not getting into a focused conversation or into a vaccination appointment during the week, or you want to wait for this, that's great. But actually, we've got a range of places that you can walk into for a vaccination. So City Hospital has a walk-in capacity, only has the Pfizer vaccine. Aston Villa has a walk-in capacity, has the Pfizer vaccine. So these pop-up services are great and will vaccinate a lot of people. but the number of people that we have to vaccinate is in the hundreds of thousands. So we need to be using all of the available options that we have.
So those watching, please go and get vaccinated. Clearly, as Dr. Mary said, the level of vaccination in our communities here in Lozells is not good enough. 4 out of 5 over 50s have been vaccinated. You know, there's still over 800 over 50s here in Lozells who haven't been vaccinated. And there's a lot of young folk out there who are, as we heard earlier, hospitalization in our community of younger folk is increasing. Get vaccinated as soon as possible. There's no excuses now. Anybody over the age of 18 can be vaccinated. They can access the vaccination centres. You know, they're literally on our doorstep now. You've got pharmacies. You've got the Nishcam pharmacy, which is in Lozells, B19 2LF. You've got the Villa down the road. You've got Holt School on Saturday. There should be no excuse for anybody who can't access a vaccination. Please get vaccinated. Please encourage your loved ones to get vaccinated too. And the quicker we get vaccinated, the quicker we will get back to some form of normality here in our country and get to do the things that we absolutely miss doing, and those freedoms that we've always treasured. Vaccination is the only way out, and the NHS have thus far delivered a very, very successful approach to vaccinations, but we need to do more in our communities. There's another question here, which I know it was answered earlier by Dr. Munir, but just to reinforce, when can you take that second dose?
So you can take the second dose only after 8 weeks. Your second dose of AZ can probably be delivered by your practice. Contact them if you've had one vaccine, but your second dose can only be delivered after 8 weeks. So we need to wait for that time. But if you get your first vaccine now, a couple of months' time, we'll be there or thereabouts, so you can have your second vaccine. We would prefer people to go back to the place where they had their first vaccine to have their second vaccine, but there is no requirement to do that. So don't let that inhibit you getting your second vaccine. Go anywhere you can get an appointment. Ring 119, they'll book you in somewhere. You can have your second vaccination at a different place. It doesn't matter. The really important thing is that you have your first, and then your second, and then you're protected. A couple of weeks after that, you're protected. So,
Mary, there's a question here about the BAME community in Lozells. I know you've shared some high-level data about Lozells. Is it broken down into communities?
We've got a small population in Lozells, so we wouldn't have that for Lozells alone, but we could certainly say for the city as a whole, and there's no reason for Lozells to be different, is that our BAME community could do better. There has been some hesitancy, but we're putting the availability of vaccine appropriate for age in the communities where we need it. So it's go and take it.
Adam Harper, who's in our community, is asking, how can we prove that we've been vaccinated? I did mention the NHS app earlier. Dr. Munir, do you want to touch upon this?
Yeah, so your GP record will have the vaccination data in it. So when you get vaccinated, and this is why it doesn't matter so much where you get vaccinated, your first vaccine or second vaccine, all of the data goes into your GP record. Your GP record is then accessible centrally through the NHS app. It has that information on that will form the basis of sort of your inverted commas COVID vaccination passport going forward. So it's centrally available. Don't lose your card. But if you lose it, it's not the end of the world. We'll give you another one, and you'll have the information online where it's directly accessible.
So, Mary, Jane from Birmingham Live makes a very, very important point that whilst we want everyone to get vaccinated, that doesn't mean you can go back to absolute normality and avoid wearing face masks and social distancing and everything else. So it's really important that people do still follow the COVID guidelines, isn't it, Mary?
Thank you so much, Jane. I was just waiting for the right point to bring this up. That whilst we do want people to get vaccinated, that is a key part of our defence at the moment, but we do still need to take our essential precautions. Having both vaccines, the whole idea of vaccinations, we're trying to reduce the amount of sickness and the proportion of those people who become sick who would then go on to die. But it doesn't prevent you from getting COVID completely. And as you know, we've also got variants coming into the mix. So get the vaccines, absolutely, but still take your precautions. And I would emphasize that you test. Keep testing. There are lots of places you can pick up your LFD tests and just test at home, test at work, test wherever you get the opportunity. Typically, we're saying twice a week. Some people will need to do a particular type of test or a certain frequency because of the nature of their work. But for most of us, the general public, we need to test twice a week. There are places you can collect those tests, keep them at home, get people tested, because yes, unfortunately, even with the vaccine, you can still get COVID. But what we know, we've got really good evidence to show, is that with the vaccine, it is typically not as severe, not as serious, and it causes less death.
Thanks for that. So Dr. Munir, one of the challenges I often hear about is the vaccine halal, and is it permissible for Muslims to take the vaccine?
Yeah, so absolutely. So and on the website that we showed earlier, there's a number of imams that have given some videos that show that it's halal. There are no animal products used to make up this vaccine. It's completely kosher. It's completely halal. It's suitable for vegetarians as well. So it's a really good option. There are always going to be some myths out there. There will be some advice that you're given that is just not true. The advice, the information I'm giving you now is that this is halal. It's been certified. It is suitable for Muslims to take. They need to get on and take it.
Dr. Mary, obviously my understanding is there was no testing done on pregnant women when they were doing the testing on the vaccine, and there's some rumors that if you're pregnant, this can have an adverse effect on you, and also rumors that if you're looking to get pregnant and looking to have babies, it can affect your fertility levels too. Is there any truth in this?
Again, so we know we've done all of this really quickly, but it has been done thoroughly. And whilst there were not specific tests done on a cohort of pregnant people, the conclusion and the advice we've been given is that actually pregnant people are not precluded from having the vaccine. So if you wish to have the vaccine, have that conversation with your clinician, get the necessary reassurance, and then they can advise you on when to have the vaccine and what vaccine to have. But otherwise, a lot of the other things out there are myths. So yes, you're correct. It was not specifically tested on a group of pregnant women, but sufficient pregnant women have had the vaccine, and we have all the data from all the people who've had the vaccine to be confident that it is safe if pregnant people wish to take it. What we advise is that they have that conversation with their clinician and get the necessary reassurance, and then they can proceed and get vaccinated.
Thank you. That's really helpful information. And if anybody still there's uncertainties, there's some genuine concerns. They've not had the flu jab in the past because they've been advised that because of certain health issues there might be some side effects. What should they do?
So speak
Go to the website.
Yeah, and speak to your GP. Do both those things. Do whatever you need to do to get the information that's going to reassure you that this is safe and effective, and it's in your best interest to take it. So sorry, Dr. Mary, for interrupting.
No, that's fine. I hesitate to direct people to their GP because I appreciate that our GPs are really working flat out. There's a huge amount of really good information that has been put together on websites that are available and trusted, provided by our NHS. So I direct people there. If having looked at that, there is still any confusion, there is still any doubt, in the interest of the person, I say absolutely pick up the phone, call your practice and, have that conversation. But in the first instance, as much as possible, look at the information that has been collated, and that information is being updated. As more becomes known, it is updated, and it's really, really good information. We've had plaudits from elsewhere about the quality of information on our websites in Birmingham. So, kudos to our NHS colleagues. That information is there. It's publicly available. That would be your go-to. It's absolutely trusted. And if you've still got doubts after that, absolutely contact your general practitioners.
Great. Dr. Munir, question there for you.
The question, so is the first and second dose the exact same? Yep. So they are the exact. So they are the exact same, Mr. Akhtar. They are the only trick, and I reinforce this, is the first vaccine not as effective as having both. So have both vaccines, but they're the exact same vaccine. There are some people that will have the opportunity to have one vaccine that doesn't suit them, and then might have a different vaccine the second time. That needs to be a primary care conversation. They'll need to have a conversation with a GP to agree that. But ordinarily, the first vaccine is going to be exactly the same as the second vaccine. The only advantage is your ability to be protected from COVID transfers from 60 to 70% up to 90 in the high 90s. So really important, get your second vaccine after 8 weeks. Get your first vaccine right now. Wait a couple of months. Get your second vaccine.
I'll just share my personal experience. So after my first vaccine, a few hours later, I felt some very cold shivers, had some paracetamol. A couple hours later, I was absolutely fine. There was absolutely no impact to my well-being after the second vaccine. So it was different. And I know other people have had different reactions. Just in my household, there's been some people have had absolutely no reaction at all on both vaccines, but one or two have had a headache or some little symptoms like that. But generally, I think there's been, from the conversations I've had, there's been more of an impact after the first vaccine compared to the second one. Any idea why that is, or is it too early to tell?
I think, when we're talking about vaccines, we want you to have an immune response. That's the purpose of them. So if you get a fever or get some shakes or a mild headache on the first day, that's exactly the vaccine working. That isn't a side effect of it. That's your body creating an immune response that is effective at building some antibodies to protect you from COVID. So getting some side effects is okay. I think you always hear very loudly about the people that have a bad reaction. 99% of the people that I've spoken to have had really good reactions. And the bad reactions, let's be clear about it, are I was unwell for a couple of days rather than one day. Or I had a sore arm. Most people that have the Pfizer vaccine will get a sore arm. I had a sore arm when I had it. It lasted a day. I didn't complain too much because nobody was listening. But and the second vaccine I was absolutely fine with. So much less side effects. So I think you'll get some mild effects. That's your immune system kicking in and working. That's what we want to happen. So most people will be fine after a day or so.
Great. Dr. Mary, do you want to pick up on this around sheltered accommodation?
Yeah, so essentially part of our delivery model in West Birmingham is going to be having some focused vaccination work and a task team that will go into priority areas, homelessness, sheltered accommodation areas. We'll focus on those, flag them. If they're not already flagged, they are on our radar. So we will get to everybody that can't get to a vaccination place. But we've got lots of vaccination places, and they're easy to get to, and they don't require an appointment. You can walk in. City Hospital, Aston Villa, your old school at the weekend. You can walk into those places. You don't need an appointment. Booking is always a good idea. I would advocate it in my practice. Book an appointment. You'll go there. You'll get seen at the time that you're meant to be seen, and you'll be out of there quickly. If you walk in, you might have to wait a little bit longer in a queue, but not very long. And we've got lots of vaccines to treat everybody. You're not going to go and be told we've run out of vaccines. That is not going to happen.
Dr. Mary, I've had a text from Reverend Allison, which is very similar to the question from Javed Kika around, are there any plans to vaccinate children?
So we're waiting for the advice on this one. As you know, the government is looking at what the benefits might be, but this is a world pandemic. This is a global pandemic, and so you have to weigh up, what's the benefit of the vaccine, the protective benefit of the vaccine, and what's the downside if you don't have it. And so far, with children who've had COVID, it seems to be that they have the COVID experience, but it doesn't seem to be as severe as it is with adults. And so you've got to weigh up what's the actual benefit of giving those children the vaccine. That work, as I understand it, is still ongoing. But when JCVI come out with the advice, it will be it'll be clear and it'll apply to everyone. I think it's appropriate that they take their time, because remember, all the feedback from all of us adults getting the vaccine is now being looked at to see, well, okay, what difference does it make? What does this mean with the variant? And so we're not rushing into what we'll do with school children. It will be a very considered approach.
Dr. Mania, do you want to pick up this question from Councillor?
Yeah, so I mean, booster jabs, there is a plan developing that the booster jabs will be sometime in September or after that. The fact about immunity is we're learning so much about this virus. We didn't know anything about it 18 months ago. We know an awful lot about it now. We're learning more as we go along. We need a bit more information about the vaccination campaign. Don't forget, we didn't have a vaccine 6 months ago. 6-7 months ago. We now have a vaccine, so we're learning about how effective it's going to be. We're seeing some wonderful results in terms of stopping you becoming unwell enough to be hospitalized, and probably avoiding you getting long COVID as well. So and the transmission reduction is significant with this vaccine as well. So there's a fair amount that we don't know, but let's not beat ourselves up. We've come an awful long way in a very short space of time, and we're learning as we go along, and we're sharing all that information with you, so we've been open and transparent about the information that we have. So I can't answer the question exactly about how long the immunity lasts for after the second jab. What we do know is it's extremely effective about stopping you becoming really unwell and getting into hospital. The booster jabs, as soon as they're announced, we will inform people, support people to get vaccinated. I think there is one point that Dr. Mary was getting to, which is we've had a long-standing understanding that if you vaccinate children, you protect communities. And that's why we have the flu vaccination campaign for children, because children don't become very unwell with flu, but what they do is stop transmitting to their parents, to their grandparents, and then the hospitalizations that are associated with that. So we do know that vaccinating children has a greater good. And we use vaccinations in children a lot, and they protect us from a range of illness, including measles, which is highly infectious and very debilitating for some children. So we know that it protects children. Vaccination does, but it also protects us in the wider community as well. So I think when the guidance comes, let's be open to what the suggestion in it is, and let's work with that.
So there's a question here: have you taken the jab? I've had both jabs. Dr. Munia's had both jabs, and I think Mary's confirmed. So all three of us have had both jabs, and that's why we're here, encouraging others to get the vaccinations too.
I can't wait, Councillor. So I'm jumping the queue because I was an NHS worker and working on the front line. So it was important that we had it, and it became available to us as soon as the opportunity came for me. I was there. Yeah, very little moaning.
Really important question. What is the difference between the two vaccines, and why can't we get the chance to choose?
The two different vaccines work slightly differently. So the approach to them is, I think although we're not explicitly saying you can choose, if you go to the City site this weekend, you'll get the Pfizer vaccine. If you go to the Aston Villa site, you're going to get the Pfizer vaccine. If you go to community pharmacy and go to the places on through the national booking line onto their website, it will tell you where you can go and what vaccines are available there. So both vaccines are brilliant. Let's be clear about that. So they are going to protect you, but we haven't made it complicated for you to choose, although we're not advocating choice.
Mary, here's a question.
And I'll just chip in with that. Sorry, can I just add to that? So some of the information we have, say this weekend, we're talking about this week and this weekend, Millennium Point, Aston Villa, and Holt Secondary, which is a Wheeler Street, will all be offering Pfizer. But they're to under 40s, and at Wheeler Street, at Holt, it'll be to adults over 18. But if you're over 40, you can go to Edgbaston Cricket Ground. So in as much as you can choose your age, you can choose your vaccine.
Great, thank you for that. Dr. Mania, do you want to pick up on this question from my friend Ricky Dehaney?
So is it true that you've had a bad reaction to the vaccine? It's a sign that the immune system is better trained and better prepared to fight loss. So I think, look, I said before, if you have a vaccine, you're meant to have a reaction. That's the point, because actually your immune system kicking up, it works better when your body's at a slightly higher temperature. We know that that's the case with any of the vaccines that we've given previously, and including this vaccine. A bad reaction, I suppose we need to just be clear about what a bad reaction is. If it means a fever and a slight headache for 24, 48 hours, that's not a bad reaction. That's a good reaction, I think. And your immune system will be trained, whether you have a bad reaction or not. It's going to be effective. So we know that people, when we looked at the data, the 92 and the 96% was made up of people who had either a good reaction or a bad reaction, whichever way you look at it. So and included all of those. The fact is, at the end of it, you get protected from COVID, and that's the most important thing.
Right. Just let those watching know that I've put some information about when the vaccinations are taking place, including at Millennium Point, Aston Village, Baston Cricket Ground, and Holt Secondary School, on the various platforms that colleagues are watching this show on.
And City Hospital, walk-in vaccination at City Hospital, 7 days a week.
That's a really good question from Mohammed Iman. Is there any public data on the infection rates after being fully vaccinated?
Not public data as far as I'm aware, but it is being monitored, and quite understandably so. So you probably missed a bit of the conversation where we said we are learning about this. We've had COVID in our lives for about 18 months or so. We've had a vaccine for about 6 months. And so what's happening now is if someone tests positive, and certainly if you have conversations with the clinician or you get to hospital, we will have you had a vaccine. And so as our population is increasingly vaccinated, we will start to learn about what proportion of people get the infection after vaccine. So I think it's probably early days for that information, and definitely far too early for any of that to be public. But it will be a really great point to learn from, because that's how we will get a sense of what vaccine has worked well and in what circumstances, and that will probably feed into, what do we need to have by way of a booster and when, etc. So really good question.
And Mary, Kearney's question picks up on that too. It's around why people are interested in a booster after having 2 vaccines.
So. Dr. Hassan, do you want to go? I'll do a short bit on this, and that is that when you have a vaccine, you get a reaction. That was the whole point of it. When you have a booster, it then builds on that previous reaction, and so you get even more protection. But with lots of experience in vaccinations, we have a whole national vaccination program. We know that with some vaccines, that reaction is sustained, and with others, it is less so. And what we are learning about at the moment is the extent to which that reaction is sustained. So the extent to which that immunity is sustained. And as we learn that, we will then be informed and guided as to what needs to happen regarding a booster. But how vaccinations work, we know an awful lot about how vaccinations work, and they vary. Whether it's measles or any of the vaccinations that we have. So when we see how long the immune reaction is sustained, we will then be better informed as to what type of booster is required and when.
Great. So, colleagues, we've had a lot of questions, a lot of clarifications. It's been a really, really informative session. So, in closing, if we can get some final remarks on why it's important, not just to be vaccinated, but also testing. We haven't spent much time on testing. So, if I start with you, Dr. Mary, why is it important to both get tested and also get vaccinated?
Okay, so your test will tell you about whether you have COVID at the moment. And if you have COVID at the moment, which you can get even if you have been vaccinated, what we want to do is to stop transmission. 90% of the transmission, 90% of the people who get COVID, it appears in Birmingham, seems to be coming from household transmission. So the whole point of getting tested is that you then don't pass the virus on to other people. We want to halt transmission. but you get vaccinated to reduce the likelihood of you getting COVID. And should you get it, that you don't have the extreme experience that we saw this time last year.
Thank you. Dr. Munir, final comments from you, please.
If you're over 18, you can have a vaccine. There's a vaccine with your name on it sitting at one of those places that you can walk into or book through 119. If you want more information, there's a website that you put on here that's hosted by our CCG that has lots of information about where you can get vaccinated, but also information around any of the questions that you might ask, the frequently asked questions around vaccinations. A range of people have inputted into that. There's an information resource there for you. If it's really important to get vaccinated, protect yourself, protect your family, your loved ones, protect your community, and let's get moving forwards. There's enough vaccine, and like I said, there's one with your name on if you haven't already been vaccinated.
Before we close, there's one urgent question that's come in. So I'm just going to ask, colleague, sorry, Mary, it's a long question. I've just covered your face up. My apologies. Does anyone want to pick this one up about... I'm
not sure that, look, I don't accept that we've done a big push on vaccinations here. What we are trying to do is we've had a vaccination program that we need to get enough people vaccinated to stop this virus impacting on our lives. The quicker we do that, the quicker we can move on. So I don't think it's a hard sell. There's lots of vaccine opportunities for people to get vaccinated. I don't want people to become more skeptical. I think they should become less skeptical, actually, because we've got lots of really good data to support this. If you look at the highly vaccinated areas, their COVID outbreaks are lower, their hospitalizations are lower. In those communities where we have less vaccinated patients, those people are vulnerable to hospitalization and vulnerable to death, and that can't be the place that we want to be. I live and work in Birmingham. I work in my practices in Ladywood. We have lots of unvaccinated people. We are going to support them to get vaccinated, to make the choice that's in their best interest, but in all our best interests.
Thank you for that response. Colleagues, look, this has been really, really informative. I want to say a big thank you to both Dr. Munir and Dr. Mary for taking time out this evening and joining us and answering your questions, talking about the importance of vaccinations. I think the message couldn't be clearer. If you really want to help us as a neighborhood, as a city, as a country come out of this pandemic, the first thing you should do is get vaccinated. And there are ample opportunities for all over 18-year-olds to get vaccinated. Please go and get vaccinated. Get tested regularly too. I think that's really, really important too. If we're going to stop the spread of COVID, if we're going to stop the spread of this Delta variant, which is obviously the most prevalent variant of COVID, which is currently in our communities, we need to get tested as often as possible. So colleagues, friends, whoever's watching, please cascade the messages that we've shared with you today to your communities, to your congregations, to the people that you work with, to your families, to your neighbours. Please encourage everybody to get vaccinated. You've got Aston Villa Football Club just down the road from us in Lozells. You've got Edgbaston Cricket Ground. You've got the Millennium Point Centre in the city centre. And if you do go to the Millennium Point Centre and you've got a non-compliant car which may be charged in the clean air zone, you actually won't be charged because they'll give you an exemption a voucher at the Millennium Point Centre, so you won't be charged if you've got a non-compliant car. So there's no excuse. The clean air zone can't be used as an excuse by anybody. And on Saturday at Holt School from 9:30 a.m, all 18-year-olds can walk in, no appointment required, and get vaccinated. And there'll be many, many more opportunities in the coming days, weeks, and months to ensure that we get everybody vaccinated as soon as possible. Once again, thank you to everybody for watching this program. Everybody who's posted questions, comments, thank you very much. My message to those spreading fake news, spreading the wrong information, please stop. You're putting people's lives at risk by posting information which is not true, which is fake news. And just think about it when you go to sleep today. Think about your conscience. What are you doing to yourself, your family, and your community when you're passing these messages on, which are wrong, which are fake news, and putting people's lives at risk? So stop it. Thank you all. Have a good evening.